All right, I open the committee of conference on House Bill 1099 with amendments. And this, as it's presented to us, has four parts to it, the original bill and then three add-ons. And what I'd like to do is discuss briefly each one of those four sections, get a sense of where we are, and then come back and decide what we want to do. So the first section you'll see is relative to medical freedom in immunizations, and clarifies that no person shall be required to receive a COVID-19 vaccination in order to receive benefits or services from DHHS. And open for comments from anyone?
I don't think the Health and Human Services Committee even amended this section, but I'm checking that right now.
Okay. And anyone else while he's checking?
Madam or Mr. Chair.
Thank you.
Okay, I'm looking at the matrix, and I think this is going to be very helpful once I figure out how to read it. At the bottom of the page.
That was also Wednesday. Go ahead.
Yeah. At the bottom of the page, one, communicable disease, and then it runs on to the second page. What is that supposed to represent? Was that to represent an amendment that both the House and the Senate had specifically to 1099 or to another bill?
I believe it shows that we were in agreement on that, but
Is that relative to 1099 or a different bill?
I think to 1099, but the word I got from the Republican leader of the House is this is moot because it's already been handled in other legislation that's passed. So the first thing is really not relevant or not needed. And in other words, if we kill it, we're not really killing anything, is the word he gave me. Representative Hunt, we're looking at the first part. You can be reading ahead, of course. Did you find what you were looking for?
We made a slight change.
I was showing you the introduced text.
As opposed to the House pass?
The House amended it, and so they're identical.
Okay.
As amended by the
That's
House.
what I,
Yeah, as amended by the House and the Senate, that the provisions and medical freedom is exactly the same.
That's what I see.
Yeah.
People's thoughts on section 1 here.
I could see myself concurring on that. My memory is not great, but I think that this may have gone through Division 3, and I had a chance to work with Representative Cushman to make some adjustments that the Senate bought off on, and
Okay.
I'm fine with this.
Once again, Republican leader said that it was not needed because it is now been handled elsewhere, which to me never means kill it. It just means we really mean it now because we said it twice. But that's just me, and I'm wordy. Anyone else? Senator.
Yeah, just a question. So was it handled on another bill this session, or it's already an existing law?
Well, it hasn't been signed. Seeing nothing further, section 2 is about the special supplemental nutrition program for WIC, Farmers Market, and so on. Representative Edwards, we were talking about this beforehand.
Yes, Mr. Chair. This did come to Division 3, and I did have an opportunity to talk to the advocate or lobbyist for this. And what we concluded from that conversation, I think I may have talked to you also, Senator Whitley, was that the $300,000 couldn't be spent anyways because the money can only be paid out July 1 to September 1, something like that. And there was just no way in this initial year that they were going to be able to get the program up and running. And so what I had been willing to do in Division 3, but I guess I dropped the ball, which is on a workload issue, I don't know what it was, but was to go ahead and seed the program with like 10,000 or 15,000. That would let the department go forward with things like RFP, RFI, and also in order to execute the program, they have to have vouchers, and the vouchers get handed out, and so they need to print the vouchers. So I wanted to give them enough money to get sort of the administrative overhead taken care of, but it didn't need anywhere near 300,000.
May I?
Please.
So I had a different understanding, and I don't know if someone from the department is here. Is Lisa from the department here?
Henry Lipner's here. John's here in the back.
So my understanding, when we came up with this number, we developed it so that the coupon that people brought to the farmer's market was $30 because it's expensive to go to the farmer's market. And so you need to make the coupon enough money so people will go. So I think we had some discussions, Representative, about the administrative side of it and whether they needed that much on the administrative side, but we do need enough for a $30 coupon.
Representative.
Okay, so I actually think I have a pretty good memory on this, which is rare. But what I'm awfully sure of is that they couldn't stand up the program this year from July 1 to September 1. So they didn't need $30 because they couldn't get it into the marketplace. So, and then if they were to start this program with the vouchers July 1 of next year, that's the next fiscal year, that's the next budget. And so I was willing to seed it, and it was either 10,000 or 15,000 because they just didn't need, they couldn't spend the rest of it. And July 1 is the new fiscal year anyways. So, but Mr. Williams has a perfect memory, I'm sure.
For the record, John Williams, Legislative Director for Health and Human Services, and I'm actually fortunate. The department doesn't have anyone here today to respond to your questions and to reflect your memory of this particular bill. But I do want to say to the bill that the department was supportive and supports the underlying bill, and we do have representatives who could answer your questions here from the audience. So, Chairman Pearson, if they could be allowed to come up, they can address your questions.
A-team to the front.
And just to clarify, they are not with the department, but they're very knowledgeable.
They're still A-team.
Good morning. I'm Tiffany Dodier from New Hampshire Hunger Solutions, and I've had some conversations with Rep. Edwards and Senator Whitley, and also Lisa Soroyce at the department. So last conversation that we had with Lisa Soroyce was that the seed money would be much appreciated, and that I can't speak to exactly if they would not be able to spend the money this year, but the likelihood of being able to get the program up and running this year would be a challenge for the department. So not speaking for the department, this is, again, third person conversation. So I think that they would be completely happy with seed money as well.
Such as the seed money, as Representative Edwards may have mentioned.
I can't speak to the exact amount.
Okay.
I know, yeah. I know, I think that her and I had spoken more around the 30,000, but I think that
But it would be quite difficult to get the whole program up and running in 6 weeks.
correct.
Or actually, it'd be less than 6 weeks because this has to pass House, Senate, and be signed. Okay.
Exactly, yes.
Hi, good morning. For the record, my name is Rebecca Wojkowski. I'm the Kids Count Policy Director at New Futures, and I've been working with Tiffany and our state partners on this, and I just want to concur with that understanding around the challenges of implementing, but how important the seed money really would be for this program.
Senator.
Yeah, so thank you for that. That's helpful. The other piece to it was that the my understanding is that the department had already made the request to the federal government or sort of let the federal government know. So they're ready to go, is my understanding.
Ready to go.
They have the approval from the federal
They have
government.
yes, they have the approval from the federal government. The
Okay.
dates are fuzzy to me about, I think that they can implement it in the next summer and still use the same plan, and that would be fine. I think the plan is approved for either this year or next year, and I think they've already had some communication about that.
Follow up?
Follow up. Thank you.
So you may have heard in the news that there's a shortage of infant formula, and the vast majority of people who are having trouble accessing the formula are WIC recipients. Is that your understanding?
Yes.
And so I certainly understand the need to be fiscally responsible. I just want to make sure if there is any chance we can get this going, that we give them the opportunity. So maybe somewhere between 300,000 is the right number. It's also $300,000 is budget dust, particularly when we're talking about, hungry babies and hungry children. And so, I'm wondering if we can come up, if you had any thoughts about a middle ground on the number.
I'd be really hesitant to speak on behalf of the department on that. I'm not sure if you have any.
Representative Edwards.
So just to clarify, we all care about babies, but this money, this program is not going to help a single mother get a baby food, as I understand it, right? This is for the farmers markets, the free vegetables, the tomatoes, that sort of thing. This is not the baby formula crisis, right? Or wrong? Can they go to a farmer's market and buy baby formula?
No, you can't buy baby formula. If I can speak, I think I'm not speaking for Senator Whitley, but I think we're talking about alleviating some of the financial burden. I think that neither Tiffany nor I should speak to what the department can do,
Yep.
but understanding that it is vitally important and it's a great program for our state. So if there is a middle ground between what Senator Whitley is suggesting and what you are suggesting, Representative Edwards, as advocates, we really implore you to consider that.
Oh, follow up? Okay, so this isn't just about fiscal responsibility. This is about operational possibility. This is the art of the doable here is to give them the money to get ready for next July. Because as I understand it, these coupons need to be redeemed within the July 1, and I forget if it was September 1 or September 30. And if we fall outside of that deadline, then they can't use the coupons in the current few months. Which is it, September 1 or September 30? I don't recall.
So, July, August, September. Yes, September 30, I believe it is. Yes.
So just to complete my thought, Senator Whitley, I like this program. I think you and I have worked on similar programs. And I can assure you that from my research and talking to people, that if we put seed money in for the administrative overhead, it wouldn't have to, 30,000 would be a lot. But this isn't about being cheap. This is just about, it takes time to stand up a program, and reality should interject itself into what we're doing.
Yeah, thank you. And I definitely appreciate that. My only hesitation, it's two things. One, it's possible that the department can get going. And I know, well, I do know that because we already have SNAP Farmers Market program. And so we already have a vendor that does that now. And so that same vendor could just do it for WIC. So we have a vendor that could do it. So my proposal would be at 100,000. And that would give us enough if they were able to stand it up by September, right? Then there would be money available if people were able to go to the farmer's market. And again, the budget does
I'm just a
also.
no at any amount over 30,000, because I really did try to research this and understand it, because I want to respect you, and when it came to my committee, I wanted to make sure I knew what I was talking about. And so I'm trying to respect your position while respecting the reality of what it takes to get a program like this up and operational. 30,000 is the most I could go.
Representative Hunt, your thoughts? Senator Gray?
Well, certainly it appears hit the microphone button. That the $100,000 is a reasonable amount, and the Senate can support that, I believe. That, you know, we not only have to look at the amount of time, can we, you know, get the coupons out for this year? I understand, Representative Edwards, you say no, but I think that there are a lot of motivated people out there who want to do the right thing for these mothers and children. Giving them the assets that they need to do that, I believe, is the right thing to do. And so my opinion, and from the nods that I've gotten from my colleagues, that the Senate position would be that the $100,000 is the appropriate amount.
The senator attributed this statement to me, but I'm passing on what I've been told by the people who would run this program. They can't get the RFIs, they can't get the coupons, they can't get the marketing out, they can't hit September 30th this year, but they can prepare and get ready for July 1 of next year. So that's not me, that's the research and the people who I talked to about it.
Again, Representative Hunt, how high would you go, starting with 0 and going to 300,000? Pick a number.
I would support my fellow representative when he makes a recommendation because he knows more about this than I do.
15,000?
They can't spend all the 30 anyways, but go ahead.
The other option is to actually hold just for a little bit on this and actually get Lisa Soroy, you know, ask if she can come and really give us some confirmation. We have other things to talk about. Maybe she could.
Well, we do, but I'm not ready to budge above 30,000 either. So we'll come back to that after we've had a minute to chew on it. I mean, I think the program is a good one, but for right now. Okay, item next in your printout, it is page 3. It's another Senate add-on. It's Association Health Plans Pilot Program. Anyone wish to speak to that? Yes, please speak to that.
So this piece of legislation was in my committee, Commerce Committee, and I think it was almost unanimously voted inexpedient, and for several reasons. One is that we already have a statute similar in place to allow alliances to be formed. But more importantly, the idea of limiting it, I mean, it turned the whole alliance thing upside down because it had a limited amount of members, which only has the potential of creating an adverse selection process. And even more bizarre was that it was a pilot program because if you're going to put one of these together, it costs money to create it. And so why would anybody put money in it if there's no guarantee that it would continue? So that's the reason why the Commerce Committee voted it down, and I don't understand why it would reappear today in this bill.
Senator.
So this was Senator Ricciardi's bill. I've forgotten the number. Maybe
I
you
don't
remember the
those
numbers. I don't know why we wouldn't do it. Excuse me, for 1,000 insured lives, it's a small number in the overall scheme of things. It would help us answer, you know, questions potentially as to whether associated health plans would have some merit in New Hampshire. You may be right. There may be no takers. We've had this conversation, but I don't know why we wouldn't do it. So I think the Senate wants to have this for consideration.
We already have that. We already have a law.
Right,
where
but I understand the MIWA law, but it hasn't happened. This is affirmative in that the Department of Insurance would develop and implement a pilot program. That's the difference. If there are no takers, there are no takers.
Right, but it defies the reason why there's no takers, of even the meal outlaws, in terms of getting that, pulling that together and making it happen. And as I will always remember Senator Ray White's comment is that it can't be viable, given that the risk of someone having a cancer or having had adverse somebody in the plan, that you needed a minimum of 3,000 lives. And that's the reason why none of these other none of these, the alliance, I forget what we call the other program, that has never gotten off the ground. And it was because you couldn't, the risk is too great unless you really have a critical mass to make it viable. So you're pointing out that it hasn't happened, and I'm saying is it hasn't happened because it's not economically rational. And so to put this on the books, just to have it on the books, to waste the insurance department's time trying to put a program together and make other insurance companies pay for it, right? Because that's how it works for the insurance department. To for just something to be on the books is wasting everybody's time. And it's also giving the false impression that this opportunity exists, and when in reality it's never going to happen when we already have a statute.
Well, if, Mr. Chairman, if I might, if you're correct that nobody's going to bid on it, it is repealed in Section 5 of the bill on July 1 of 2025. So I see absolutely no harm with the affirmative declaration that the department should try to go forward with it.
Right.
So I think since we've held on Section 3, I think the Senate would ask that we hold on Section 4.
Hold. What do we mean by hold? What are we're holding on
Just
until?
continue to discuss it.
Okay, right. We won't unilaterally eliminate it yet. That's fine with me.
I don't have Senate Bill 286, so therefore I don't have the fiscal note with me. If anybody does, what does it say?
I don't remember it having a fiscal.
I don't think it had a fiscal note, but I'll look it up.
Um,
Was it Senate Bill 286?
286, the side-by-side far right column calls it 286-FN.
My computer turned on it. Look.
So technically, in
It had
terms
a
of
fiscal note, I'll just read a couple of things in it. The insurance department indicated it can assume the responsibilities associated with this bill within its existing infrastructure with no impact to the operating fund. Where the program is limited to 1,000 participants, the department assumes the impact on premium tax, if any, will be small. And in terms of appropriations, there's none. In terms of revenue, indeterminable, and expenditures, 0.
I was about to say that's what I would predict the FN would say. So no, it's not. It's in terms of the department's energy, it's just going to sit there anyways because they know too. They know better than I do that this is never going to be used. No one's ever going to pull this off, and I would say that I've taken the position many times in the Commerce Committee that if we actually had somebody coming forward viably wants a legislation, when it even comes to the idea of buying health insurance across state lines, I say, show me that one insurance company who wants to sell it across state lines. Show me somebody who really is going to put this plan together that has a viable market plan, has a plan to make it happen. Then the Commerce Committee would absolutely jump with joy and pass it. But at this point, we've already been down this path so many times. We know it's not reality.
So you'll be a no.
I would be a no.
Okay. And having studied medical studies a little bit and having listened to some conversation about this, I would agree that 1,000 participants is unwise. It's too small. So I'd be a no as well. So I think that kills this section. And the last section it starts on the bottom of page 3 they number it 7, Medicaid enhancement for children and pregnant women. Anyone wish to kick that one off? Senator?
Yes, so this is something that both the Senate Health and Human Services and the House Health and Human Services really looked at a lot. There was
Yeah.
a lot of discussion. I know House Finance also looked at it a lot and got a lot of testimony on it. So it is incredibly important right now because it's this opportunity to extend coverage in the Medicaid program for women from 60 days postpartum to 1 year postpartum. And so we know that there's a lot of data and evidence to show that, if we can keep moms healthy and keep them healthy by affording them coverage, we're also keeping babies healthy. And so, for a whole host of reasons, access to coverage is incredibly important for women postpartum. So it's an opportunity from the federal government I think we really have to take advantage of.
Could the chair ask Representative Weber to do a little lookup to see how our committee did when this bill came to us, please? Thank you. Representative Edwards?
You know,
I don't know.
Senate Bill 407.
Senate bill, yeah. Thank you. Of course she does.
Yeah.
And I'm sorry for. I would like to know how the Health and Human Services Committee of the House voted on this. I do remember that now, yes. Okay.
and while you
Representative-
got that up, would you, Division 3, I think probably passed it 7-0, I'm thinking. Okay, that's finance, but
So.
What happened is just
What happened? Yeah.
you attached House Bill 1210 to it. So you supported the program. The House did. Sorry.
Thank you.
That was Representative Lang's vaccine bill, which had a lot of debate. So we didn't concur with that bill, and we attached the Medicaid piece to this bill. That's what happened.
Thank you.
so in summary,
Representative Edwards.
it sounds like the House position on this is that the two relevant committees heard it, agreed with it. It went to the House floor, and I believe we passed this just like a week ago. Is that there's a researcher back here. What was the House vote on this?
So the House position is we pass this through committee, through the floor? So this is the House position that. I know from being married to a doctor, there's this, for lack of coming in when you should have, Mr. or Ms. Patient, because you didn't want to pay the copay. Now it has gotten very expensive and you feel like bleep. So pay me now, pay me more later. Representative Edwards.
So just to put this in context, this is only picking up an additional 10 months for a wedge of clients or patients. It's those that are above some percentage. I think, I don't remember it exactly. Maybe it was 140% of the federal poverty up until 298% or 296%, something under 300%. And in that wedge, there was an estimate that would include 570 approximately women that wouldn't have otherwise been covered. And then I think I recall that we anticipated about a quarter of them would actually need the services and we'd be spending more money. So we're not solving the world. We're not boiling the ocean. We're just trying to help a relatively limited number of people get the additional postpartum care. So I think given the House position, I can support it.
Representative Hunt?
I don't have any problems with supporting it, but other than I guess it's this games, we have things getting moved around from one bill to another. It's a little tiresome because I went through this on Friday, and
Before you go there, 4 of my bills were taken under advisement by the House, and a lot of things added to it. So, John, please
well, I
stop
understand. I'm
right
just
now.
saying. I was just here. This is just
Please.
more of the same. Okay.
We share each other's tiredness. Senator Gray.
I think that the House accepting the Senate's position.
Okay, well, working backwards then, starting with this one, we are all, both groups, Senate and House, yes on Medicaid enhancement for children.
Yes.
Yeah, yes, yes. Yeah, we actually
Yes.
decided to vote, yeah, okay. So now let's go backwards and look at 4 and 3. I think there were some trade-offs in mind here or something.
Mr. Chair, if I may go,
Yes, please.
I think we could accept something between 30 and 100. So
On
why don't
number
we,
2.
here's what I'd suggest, Mr. Chair.
Okay,
Why don't we, I need to give some thought with Representative Hunt to the associated plan piece. Why don't you think about what you could live with between 30 and 100,
mm-hmm,
and we come back in a day or two.
okay. All right, so we can hold on 2. And now
And
the
hold
pilot,
on 3.
sorry,
And 3.
and hold on 3, okay? Back to 1, no person shall be required to receive a COVID vac to receive service from DHHS. I don't think any of us have any trouble with that. The question is, do we need it? Because
We
there's no,
both passed it.
then we'll pass it. That's my plan. If it's good once, let's do it twice, but, okay.
Well, actually, a third time, John.
Well, that's a charm then, sir. Yes, Representative.
I just want to go back to the horse trading idea over a number between 30 and 100,000. I swear to God, the amount of money that they need to get this program started is less than 30,000. Any more that we put in there is one of 2 things is going to happen. One, it's just not going to get spent because they can't spend it that much on getting the program started and getting the coupons printed. Or worse, they spend it on something else and it's wasted, or at least it's not authorized. So I'm not like just picking 30,000 out of the air. You know, that just seems to me to be the maximum reasonable amount that we should go to. But we can take a couple of days to think about it.
And if I may, Mr. Chair, if we're going to wait 2 days anyway, certainly that will give us time to bolster our argument that the money can be spent, and that we would request that time to be able to do that, consult with the department, and try to make this a win-win for the state and the mothers and children.
If we go to recess, we need to, well, I have a, no, well, it's 12. It's 12. I have another one that's going to be recessed. They don't know it yet. If a committee of conference meeting recesses, the reconvening time shall be posted on the general court with 12 hours' notice. And is this not a committee of conference? That's not what I'm reading in front of me that was sent to me.
The key thing that you're reading is that when it comes time to schedule, it has to be 12 hours. So if you, you know, in terms of the, rather than 24 hours, but it's 12 hours in scheduling. So, so
Whatever
you
it
could not
is,
schedule it for today.
no, I was thinking of tomorrow.
Reset. Yeah,
I'll use whatever word is licit to get whatever it is we want.
take a break.
So
Senator,
can I make a
you
suggestion?
may make a suggestion.
Based just on scheduling. I would propose that we come in at 9 AM on Wednesday morning.
I'm having eye surgery on Wednesday at 9 a.m.
Oh, okay.
If we do it later in the day, my one eye and my shoulder parrot can be present.
Are you sure about that?
No, I'm not. How about tomorrow?
I already have half a dozen at least.
Yeah, so do I.
I could do tomorrow, like 8:30.
I could do 8:30. 8:30?
Okay.
I can do 8:30.
8:30.
I could do tomorrow at 9. I have another one at
No,
9:30.
it's
I
gotta
have
be
one at
8:30 for
9:30,
me.
but
Well, good, then we'll get that pilot program through.
At the end of the day, you need my signature. You don't need my presence.
are we agreed on 8:30 for
Can we do it later in the day,
8:40?
sometime?
Yeah, 4 o'clock.
4 o'clock?
I could do 4 o'clock.
I can do 4 o'clock
That would be better. for
Tomorrow
me.
or today?
tomorrow.
4 o'clock tomorrow.
And guess what? That's over 24 hours. Okay?
Yes.
We'll come back tomorrow at 4 on 1099, and I declare us in recess. And I'll call the clerk. Thank you. Let the phone calls begin.
I know.
My problem.
I know.
That's why I wanted to wait until Wednesday.
Yeah.
So that she sees we fought hard for her.
fast. I know it is. Okay. It is 10 o'clock, and this is the Committee of Conference for House Bill 103 FN, establishing a dental benefit under the state Medicaid program. And as you know, there were two different positions on relatively minor issues. In the intervening time, when we requested a committee of conference, we received additional information which made us agree with the Senate. And so I would like to move for the House delegation that we accede to the Senate's position. Is that okay?
I don't know how this works. Do you
I
need
don't
a
either, but
motion?
it sounded pretty
Like
good.
I can make a motion that
You-
we
well, all
accede to
right.
the Senate position on HB
You may
103.
make a motion.
I move that we accede to the Senate position on HB 103.
Okay. And Leon is seconding.
Yes, I will second that.
And so Representative Wallner and I. Do you agree, Representative? So do I. And the Senate's position, did you agree with the Senate position? And all in favor say aye and
Aye.
sing one verse of Kumbaya, and you can go after your next meeting, Senator. Now I adjourn the Committee of Conference on House Bill 103.
And wait, you can't adjourn just yet because Dr. Finney's going to do the chicken dance for us.
Dr. Finney is recognized for 30 seconds. And Mr. Lippman can do the hokey pokey because that's what it's all about.
Well,
Welcome.
especially since we already passed the language.
Representative Weber, to your knowledge, is there a quorum requirement? We have the Senate here, we have us here. Good, thank you. Forgot my gavel. Okay. I forgot my gavel. Okay, thank you. Dr. Woods is the hand surgeon, you know, yes, well, it's close, and I do, and I have a doctorate too, but it's in theology, so. Anyway, open the committee of conference on House Bill 1439 relative to healthcare facility visitation policies. And you should have a side-by-side. Each one of us has a side-by-side. And there's basically about 3 or 4 items at issue. And I'm going to ask my policy committee vice chair, Representative Leon, if she would speak to those, because you have something prepared.
Thank you, Mr. Chairman. There are 4 differences between the House and Senate version. The largest is the placement in the Patient Bill of Rights versus in the licensing statute. I think that that's something that the House is going to accept, moving to the Patient Bill of Rights, because we need to move forward on something here. Additionally, there's the documentation need. So the House viewed that it was very important that if there was a patient who was contraindicated for visitors, that there was actually a patient-specific reason for that contraindication for visitors. And as such, if there was a contraindication, something would already be charted, and it would make sense to note that the patient had their visitors asked to leave because they had a significant event that contraindicated those visitors. That's something that we are willing to set aside at this point, because we're much more concerned about the 2 other ones. The first, letting people know that we've heard their voice. We've heard too many people that didn't have access to their loved ones, and simply adding the 4 words at the beginning of this section in the Patient Bill of Rights, "No patient left alone," will be a nice touchstone for those people who have had a traumatic past 2 years. This trauma has been in the healthcare facilities with our heroes that have been working on the front lines. It's also been in our families and in our community, and we need to come together and heal this and move forward. So the first part would be to replace the first section and just add the words "no patient left alone" right after XXII. That would show up right on page 1 of the side-by-side on the Senate side between the XXII and the A. We would add the words "no patient left alone." And hopefully that is something that we can all agree upon in order to just understand where everyone is coming from. The other section is really a de-escalation issue. There are conflicts over visitation policies, and the easiest way to calm a conflict is to be able to hand something to somebody in black and white and say, "Here are the rules. We're not doing anything different for you. These are the rules to keep people safe. Please read through them. Let me know if you have a problem, and then we can discuss it. But the rules are written, and they are here." The House had said that we were going to place both the Patient Bill of Rights and the written hospital policy on the wall of patient treatment rooms. We don't really need to wallpaper the rooms, but we do need to make it very clear that this information is available. So we have the language to put an informational sign in all patient treatment rooms to make the patients and visitors aware of the contents of this the section of the Patient Bill of Rights. Aware of the contents of the Patient's Bill of Rights and their right to receive a current printed copy of the written hospital visitation policies upon request. This is a great way when somebody starts getting a little bit agitated, you hand them a copy and say you'll be back. We went through a lot of work on Senate Bill 459 for de-escalation to reduce workplace violence, and I believe that this would go hand in hand with that. So I believe that these are 2 very important changes, but I think that they still honor the request to move this to the Patient Bill of Rights and to not add any documentation requirements to our stressed healthcare system today. Thank you.
In talking with various members of the House Health and Human Services Committee, I was particularly happy to hear from Dr. Woods, I use his title deliberately, retired, I think, president of the New Hampshire Medical Society, a hand surgeon, and so on. And he thought there was merit, again, not to wallpaper the room with all the rules, but to have the salient ones posted in each room with a reference to where they can be found online. There they are. We're not hiding anything. We're not saying you got to go out and punch up something on your computer, but basic things are there. I also recall we were told that, oh, the hospitals are pretty compliant with these things. And my response whenever I'm given that statement is, then you have nothing to fear. If you're already doing a good job, now you get extra credit because it's posted. So I would agree certainly very much with that. I know from being part-time chief executive officer of a small medical facility, when a certain thing happens, it's important to document it. And if a patient is told you can't do such and such regarding visitors, or a visitor's told that, put it on the chart rather than relying on somebody's memory later on that this might or might not have taken place. Again, it's that with the title of this is de-escalation. As I said in the House hearing, being clergy, I have for 47 years, I've been in hospitals a lot, visiting a lot of people. And for the most part, they do a wonderful job. They do try to accommodate. There are occasions when visitors are unruly and need to be dealt with. There are other times when an overstressed staff occasionally misses something that they should have done. For the most part, things have run incredibly well. So I come to the hospital visitation policy bill, not hostile at all to the hospital, but very much wanting to just let people know who are overstressed that you've been heard, you've been valued. Senators.
Thank you, Mr. Chair. And I would, first of all, I really appreciate the keeping this in the Patient Bill of Rights rather than going into licensure. Actually, in the Patient Bill of Rights, it may actually have more clout because the licensure body looks at technical issues, but in terms of comprehensive nature and compliance with your own policies, that's where you get into accreditation, which actually has more clout than licensure. If you're not accredited by CMS, you're in trouble as a hospital. You're not viable. And they look to being compliant with your Patient Bill of Rights, whereas it's only the state with licensure that would be looking at it if it were sitting in licensure. So I really appreciate that recognition of where this is going to have the most impact and where it sits most comfortably. I think the No Patient Left Alone Act, this to me, I understand where it comes from, but no frontline healthcare worker over the last 2 years has ever left a patient alone. What we're really trying to do is to make sure that under all potential circumstances, unless there's some really overweening reason why it can't happen, the patient should not be without their loved ones or the people who care about them. But this is so broad that it's almost like no patient should continue to be neglected. And as a physician who's practiced for over 30 years hospital-based medicine, to me, this really could be taken, and I know it's not meant to be, but it could be taken as being incredibly inflammatory and offensive. So if we can rephrase it in a way that really targets what the bill is trying to do, that would say, I know it's not very, the wordsmithing would need to be done, but I would prefer it to say no patient without their loved ones unless there's a really no qualified, competent physician, nurse, LNA would ever leave a patient alone. In fact, in COVID, when there were these really tough provider issues and visitation issues, we had, I mean, the visuals of CMC where the the nurses were doing signage back and forth and with the families who couldn't come in and making sure their loved ones had that. This to me doesn't capture the commitment on the part of the workers in the hospitals and how much they care deeply about the patients and making sure that their loved ones can be there. So if we can come up with different language, I have no problem reinserting this, but I do have a problem with these words because I think it's too broad in that it also could say, don't neglect patients, which does not happen and it actually would be malpractice. So we shouldn't be having something in statute that uses those words in my book. And I see Lucy has her hands up. But the other one that I was concerned about is how we let patients know. I would prefer a system where patients are provided with information on admission that they can have with them. You know, there is a packet. Most hospitals, and Paulo or Steve can help me with this. I know my hospital has a bifold packet that has all the patient information in it. You could either have that bifold packet that actually would have visitation policy on it, you know, as a part of the printed packet on the inside, maybe that's very prominent. You could have that bifold packet that also showed where to go online for it. And one thing I'd add to this, but because I think it's really a great idea, many patients don't know that every hospital has a patient advocate. So having how to access the patient advocate in that same information packet, that would go with the patient to the room. It would give them how to do a daily update on visitation. The family would have access to it. But it would, again, get away from the idea of wallpapering the rooms, which actually can get into sanitation issues. Some of these rooms, they're very careful about what they put where, especially in a room that has ventilation to prevent, say, the spread of COVID or TB or other airborne diseases. So my preference would be to have, if you're going to have required notice and you want to broaden it, let's use a vehicle that's already there, which is this packet that's given at the beginning of every hospitalization. I'd need to ask Paul and Steve what they thought of that, but it would just be expanding what's already given to the patient by virtually every hospital. And then it moves with the patient. So it sits at their bedside, it's accessible. And it would be something the nurse could then print out and give to them if there's any question.
And also, Senator, while you're up, the fourth item would be the reason for denial of a visitor for medical or therapeutic contraindication shall be documented in the patient's medical record. That was something the original sponsor wanted. What do you think about that?
Well, you know, we already document so much, and I'm not sure that's the clinical record is really for the clinical record. It's not for that. If I don't see that as being something that is appropriate in the clinical record. The only place I could see it possibly going would be in the nurse's notes, but then it would get kind of lost in those. So I would, in my world, having worked with EMRs, they're all different. They all have different templates. And if you are having to put in visitation policy in your EMR, it's yet another thing. And if you ask any healthcare professional, you know, what the EMR is for, it's for things that are clinically appropriate for the patient. So I would prefer to not have it in the EMR. Is there another place where it could be documented? there might be, you know, but I'm wondering if there might be some middle ground if you feel very strongly on it that at patient's request or at the discretion of the nurse, rather than having it happen every single time, that if a patient requested it, it could be put in the nurse's notes, the reason for it. But I think of it as one more thing we have to document, and I don't know why it would be clinically necessary or appropriate. And I also don't really know what that information is going to be used for in the future. So
My guess would be if there is an issue.
understood. We already have a mechanism for that. If
Okay.
you look at the, and Paula or Steve could probably explain this, or, you know, anybody from the hospitals could explain this role of the patient advocate. When we do have an issue, we have people in my hospital, we have somebody who will come up, interview the patient, and then we'll start an actual file that would track with that patient. But it doesn't go into the medical record. It goes into something that is, you know, legal, that's accessible, and it's a document that goes along with the patient advocate. So, but to have an every time, you know, documentation of something that likely will never be needed, but if it is needed, we have a mechanism already to document that through the patient advocate program. And I believe that's a requirement of CMS or accreditation that you have to have a Department of the Patient Advocate in every hospital. Is that correct, Paula? Or do you know? Okay. Every hospital I've ever worked in has had that role. So that might be a better place for this. And that could also be explained in that initial packet that we go out.
Senator Bradley, this is the opening salvo here. Senator Bradley.
Well, I agree with Senator Sherman. I'm glad that this is staying in the Patient Bill of Rights. In terms of the emergency medical records, I have the same concern that Senator Sherman has, from a slightly different perspective, I guess. I think we all know that just the amount of hours that staff is having to work now, asking to do one more thing, undermines patient care, when there ought to be, whether it's through the patient advocate or not, some other way of doing it than having nurses or whomever always document in EMR this at a time that we're having a hard time hiring people. So I would be opposed to doing it in the form that it's suggested here.
And of the other three items, we're looking at the title. The bill sponsor wanted it No Patient Left Alone Act. I'm sure wordsmiths in the room have a great alternative. In fact, I think I'd like to call on Representative Weber.
I was just going to suggest the Patient Support Act, because it's the patient and the support for the patient that is the important thing. And obviously, I think we don't want to imply that they're abandoned. We want them to have the best support that they can have.
I put down Patient Visitation Act, but I like yours better. It's warmer. Senator Bradley, is that okay with you? Senate Patient Support Act?
Again, I think Senator Sherman and I worked closely and carefully with the Hospital Association. I'd want them to look at any proposed language change. I mean, these are their buildings, and the stress upon our medical workers and our hospitals as institutions has been significant over the last couple of years. And so I think we need to make sure that we're not outthinking them. And I think it's important that they look at this language and get back to us. I mean, I would just note that the sheet that Representative Leon gave me, with the exception of the title, the language is identical. So, I'm not sure where the big issue is.
Page 3, Senator Bradley, under information that is posted, the question as to whether the policy should be online only or should be posted, and Senator Sherman gave another
Yeah, no, I
option.
would
What do you
agree with
think?
Senator Sherman.
Okay.
Look, I was told that sometimes these visitation policies during COVID changed multiple times in a short period of time. So again, I think Senator Sherman brought up a good point about sanitation. I go back to, the actual workers being overstressed, they're being asked to do more with less. It seems like if we can refer people to an updated policy change on a website or hand them a piece of paper that has an updated, then you're not having to, go through large hospitals, repaper every room. It just doesn't make any sense to me.
Okay, I've heard from 3. Let me weigh in a little bit here. It sounds like, do we have consensus on Patient Support Act as the name?
I love that name.
Okay, so we're good on that one.
Well, again, we can tentatively say we're okay, but I don't think myself, I'm not signing off on anything until the actual language has been reviewed by, the people that run the 26 hospitals.
we'll be talking and listening in a minute.
All right.
I'm just looking at us. We seem to agree that something should be documented somewhere in case there's a refusal, and a refusal that could be escalating, and a refusal that could lead to a lawsuit. And having been asked on a couple of occasions as a clergyman visiting a hospital, information about what went down, I know what went down, and what I said I saw was written down somewhere. And I think that was to protect numerous, not just the patient, the visitor, but the hospital too. So we are looking at where is the best place for that.
I think it would be helpful to, again, talk to the
will.
hospitals before we move forward with this. I feel very strongly the electronic medical record is not the appropriate place. This is not a clinic. I don't want to minimize the therapeutic benefit of having family, clergy, and visitors. It's really important, but this kind of legal documentation, I don't believe has any place in the EMR. And just like Senator Bradley said, it's one more thing on every patient that they have to document. On the other hand, I would defer to the hospitals. Do they already have a mechanism for when there is an issue with a patient or with visitation or any issue? Where do they already put that in terms of their hospital documentation? I think that's what we need to get at. And if it already exists, I don't want to reinvent the wheel and put that also in statute. If there already is a place for them to do that, I would leave that alone.
The chair would like to call up Ms. Minahan and Mr. Ahern so we can ask you these questions directly and hear what you have to say. So I'll walk you through what I just walked ourselves through. As you know, there's a backstory. There's a lot of backstories behind this bill. And waiving off certain parts can be inflammatory. And I don't want that. I don't want it in my center. And believe me, we've had conversations with our staff as to maybe it's a little bit more work, maybe it's a pain in the neck, maybe the patient is a pain in the neck. I'm trying to diffuse things here. At the same time, I don't want to overburden unnecessarily. So, Patient Support Act. This seems to be in some form quite important to people.
Thank you, Representative. For the record, Paula Minahan, for the Hospital Association, and
Steve Onen, Hospital Association. And, you know, with respect to Patient Support Act, I agree with Senator Sherman. Sort of the notion of leave no patient alone signals something that we're not doing. We're not leaving our patients alone, and that's not what this is about. So Patient Support Act, I don't have any real issues with. I mean, this is in the patient's Bill of Rights. So it's all about patients' support. So I don't think I have a real concern about that. I'm not overly certain that it's necessary, but if there's a belief that that's an important point, and I understand the importance of visitation, nobody needs to convince me about the importance of that. But at the same time, we have to recognize that, you know, there are times when we can't always do exactly everything that we would like to ensure the health and safety of our patients, our staff, and our communities. And unfortunately, you know, that tension certainly, you know, ran headlong into one another during this period. And I understand that. But I think, again, what we're trying to do is to ensure that we can have patients visited by their families and loved ones in the best way possible, in the safest way possible. But as we've said, there are times when we will need some flexibility to ensure the health and safety of our patients and our staff and our visitors. And we believe that, you know, certainly the Senate language comes much closer to that. So as it relates to Patients Safety Act, or
Patient Support
Act, I'm
You're okay. Okay, Senator Sherman, you want to jump in on this?
Yeah, I just wanted to ask a question. You know, jumping forward, can I ask about the EMR question?
I'd like to take it in order,
Okay, I'll wait.
but hold that thought. The second item is it should go, where should it go? Patient Bill of Rights, did we like?
Yes, the Patient Bill of Rights works.
We like that. So we're in agreement on that. That's where it should be placed in the law. Okay, so we're down to 2, and we're 2 for 2, and we're encouraged. Now, reason for denial of a visitor. I know from living with this daily that we've had occasions that were untoward, and we wrote it down somewhere. And I think EMR is probably not the place. I wish I'd asked my wife, where do we put that information? But we put it somewhere. So where would be the best place for a documentation of this?
I guess our concern is, and I think Senator Sherman touched on it, as did Senator Bradley, we need flexibility, and I think I have been consistent throughout the entire process dealing with this bill. Hospitals need flexibility. What Exeter Hospital has might be very different than what Dartmouth Hitchcock has versus a small critical access hospital in Wolfboro. So that's our concern. Is I don't think honestly it needs to be here because it needs to be in statute because they're already doing that. So to put it in statute, we will need to go back to find out what it would be called, but I think Senator Sherman made another good point that they have patient advocates. I mean, I have worked with hospitals when there are issues that they do have a patient advocate that gets involved and they help with that whole entire process. So again, to be prescriptive is a problem because they need that flexibility because not every hospital functions the same.
Dr. Sherman.
So if we just walk through this bill, the first iteration, we have to document why there's a denial. In the heat of COVID, when things were at their worst, or even last November when we were with the Delta surge, we had blanket policies across the entire hospital, no visitors. I don't know if we did that back, I think we did that both times, but certainly in the height of the pandemic, about a year and a half ago, there were no visitors allowed in my hospital. It's 104 or over 100 beds, and we were surging. So we had probably 120, 130 patients. That would have meant that the nurse would have had to write in every EMR that the reason for denial is this is CDC guidelines, this is coming from the DHHS or whatever. That to me is unworkable. putting it in. The second part would be, what would be something short of that if there's a dispute? Well, first of all, we know that you all have documentation of your hospital visitation policies like that. It's in the record of the hospital. So if there were any litigation which has been brought up, the hospital has the records and the justification for their hospital-wide policy. Again, no specific patient-based documentation needed. Then you get down to the specific patient-based problems. When those disputes arise, or if there's an incident, part of that is what we were trying to get at with workforce safety, healthcare workforce safety. And unfortunately, I will remind this body that the compulsory nature of the commission and of reporting was removed by the House. You know that we had, coming from the Senate, we had that every hospital had to participate, and that was removed by the House, I believe, in the final version, so it becomes more voluntary. I may be incorrect, but that was something that came up. And that's not really so important as much as what we're trying to do here is make sure that if there is an individual issue, where do you find documentation of that issue? And I would propose that we put that off of this bill, not included in this, for two reasons. Number one, we have the Hospital Association sitting here saying this is something that the legislature would like to make sure is somewhere in the documentation of the hospital. And your homework assignment so we don't end up having to put it in statute is to find out where that is and make sure it's uniform across all the hospitals. I suspect that that is part of your accreditation process, and that having an ability for a patient to bring a concern forward and have that documented as part of accreditation, because I served on the regulatory committees of my hospitals. But I don't think we need to put it in statute, especially if it already exists. And I do believe, for the reasons I've already stated, that the EMR is the wrong place for it.
Ms.
Sorry,
Mayhem.
yes. Sorry. I would agree. I also, we look at it, there are always exceptions, again, for, in the case of labor and delivery, in the case of end of life, in the case of a child, hospitals were able to make accommodations when appropriate. But again, this was on a case-by-case basis, and you can't legislate that. That's what's very difficult. But that is what the conditions of participation, what CMS and the Joint Commission and DNV require, is that they have the documented policy. So like you said, where it's the 80-20 rule, it's almost like the, 99-1% rule, that the exceptions will, if we put this in the Patient Bill of Rights, I think that could cause some confusion. So.
I'd like to call on Representative Leon on this.
Thank you, Mr. Chairman. I do think that there's some misunderstanding about this section here, because it states that when visitors are non-compliant with written hospital policy, that they can be denied. So that is separate than anything that would require documentation, because if we have a blanket ban on visitors, that's already covered separately by Section D. The documentation is only for an individualized medical or therapeutic contraindication. If it's something that's more general to the hospital population, that would be in the policy. This was spoken about when somebody was coding and there was a family member who was thought that they might pass out. There was something that was an invasive thing. They were cleaning wounds where they knew that it was going to be traumatic for a visitor to watch. And those were the types of issues that were brought to us about these medically or therapeutically contraindicated for the patient. So I think this is a lot narrower than has been interpreted, but I do think that this is something that we can figure out how it's handled in the hospitals, but this is not a blanket documentation requirement. This is something for those individualized cases where this is necessary for the patient. And then I guess I did have some other questions, but I can wait till we get to those sections.
That's how I read it as well. If somebody's threatening or violent, no, EMR is not where it goes, but it goes somewhere. And I'm of the mind that you've heard what numbers of people are looking for, and my own preference is I could live without this specific statement when you get back to some committee that I chair and tell me what you've done. And I think it'll be good what you say, but I think people need to know it's there.
Understood. And I guess I would just, sort of echo the comment that Paula made was, I'm not certain that this is something that needs to be in statute. There are things that we can, work through. And I think, again, we're looking, as you said, Representative Leon, sort of a narrow set of issues. But again, I don't know that that's a requirement for legislation or for something in statute. But we're certainly willing to come back and talk about that.
Could you live with that?
I can live with that.
Okay. 3 for 3. And the last one is the ready availability of the Bill of Rights. Not wallpaper, but not, oh, you got to go look for it online somewhere, but somewhere in the middle. What could you live with?
What I would suggest is, let us come back. Again, I don't know that we need to legislate this issue, but let us work with the hospitals to try and figure out what is the most effective and efficient way of informing our patients of what those policies are and how they can find more information. Senator Sherman talked about, documentation that people get when they come into the hospital when they're admitted. I don't have 26 versions of those in front of me, so I can't tell you exactly what each one of them would have. But I think that's something that we can certainly, work with our members to help make sure patients are informed of what those, what those policies are and how they can, find more information if not just asking, the representative there at the time.
Yes.
Thank you, Mr. Chairman. It sounds that this would be an issue of hospital policies. Would it make sense to say that a written copy of the current visitation policies will be made available upon request consistent with hospital policy?
I actually just reviewed the conditions of participation for critical access hospitals, which are a little different than PPS hospitals, but this section is similar. And that is a requirement already. That is why we don't believe that some of this needs to be in statute, in state statute, because they're already complying with this. And there are hospital policies. That's why hospitals have risk management committees and departments to ensure that they are protecting patients. And this is all about patients. And we can look into that as well. But I believe that they already make it available. When I know I've seen them when you register, they put the patient bill of rights up there. But I think it could also be in the packet. So I don't believe we need to legislate this.
As the one who edits the quarterly newsletter for our medical facility, it occurred to me some years ago that it's not enough that when my medical staff meets at a staff meeting, we know. Our patients need to know what we know. Mm-hmm. And to say we have a policy to each other isn't enough when the patients need to know we have a policy on this available upon request. And so I use our newsletter as a vehicle each quarter to inform the patients of specific things. Mm-hmm. We've never been challenged. They trust us. They love us. We do great care. They know we know, but they now know what we know. Mm-hmm. And that's the one link that's missing, that's behind this bill, is this fear and this panic and there's this and this that. And sometimes more communication than necessary may be necessary. Mm-hmm. And that's what's behind this. And I personally would be willing to say, well, there was this political figure a number of years ago who was asked if he trusted the communists in USSR. And he said, yes, trust, but verify. Mm-hmm. So to get back on this, to say, here is what we're doing or we could do to honor the concerns, the fears, the paranoias, the whatever behind this, would go a long way to be able to say, yeah, we get what you're coming from, and this is what we're doing. And maybe we can do a little bit more. I could live with that as long as the report comes back to me fairly quickly, because there's legislation file period in the fall. And if on these two items there isn't adequate response, which I don't expect, I think there will be adequate response. But if there isn't, then we can file a bill and we'll know why we can file it. So, I mean, that would be my deal that I could live with.
I'd still like to have the written stuff, have it clear that the patient is able to get the written policy and the patient advocate information upon request in some way consistent with hospital policies without dictating the requirements.
And I would just suggest, Representative Leon, that that is redundant, because I think it's already provided, and I would just need a few minutes to just find it. But I believe that it is already, provided upon request. So it's somewhat redundant. I don't know that the bill needs to be amended to incorporate that. That would, but.
My one question is if the patients know that they can request that.
I can't speak, neither can you, for every patient, but it is, like I said, it is posted when they are going through the admission process, and it probably is in the packets that they also receive when they're admitted. But I have to confirm that.
And I would just suggest, putting it in state statute doesn't necessarily mean that that patient would be more informed. So again, as I suggested, let us work with our members to, ensure that that information is being provided. And if we come back and we tell you that that's not happening, then you'll have an opportunity to move forward on something else. But again, I believe that, our members want to do everything they can to ensure their patients, get the right care at the right time, at the right place, in the right way, and that they're supported throughout that process. That's what we are committed to doing. That's what our members are committed to doing. And again, we're happy to come back and share that information with you.
Whichever version of this is accepted today will include the words, each healthcare facility licensed pursuant to RSA 151:2 shall post on its website, and it lists a bunch of things. You're going to have that, whichever version we agree to. We're just some of us are just suggesting it might be teased out a little bit more specifically for the patient. And you're going to come back and say, this is what you have been doing. And you might even want to say, and pursuant to this conversation, plus we're going to do this as well. And that would be very helpful. And remember, we're dealing with fears. And they have a reality of their own, and we all want to defang them as much as we can.
We all want to find ways to work together.
Of course we do. And remember, I deal with this daily. Well, I think we're there. Are we there? Patient Support Act, we agree with? Yes? Okay. It's in the Patient's Bill of Rights. We agree with that. We are going to punt on the reason for denial, but they're going to get back to us on that. And we are going to punt on exactly, other than the website, the information's available, and they're going to get back to us on that. So in those last two cases, we would agree with the Senate's version. Are we there?
Assuming that the information is in fact provided, I'm great with that. If we find out that there's a lack, I definitely appreciate support in passing this next year if we need to do something. And if that's the case, then I can agree with this today.
So I think we're done. Good. Thank you, everybody. I'll go down to OLS and walk them through what we're doing. It succeed to Senate on points 3 and 4. Actually, I think it is exceed to Senate on 2.
I think it would simply be inserting the words Patient Support Act, and I
I
can
think
figure out
that's the
exactly the
only
line.
change.
That's the only change.
That's
That's
the
the
only
only
thing.
change. I'd say we're good to go.
That's what I have, Senator.
Okay.
Okay? Good? We're done? Thank you. Wow.
Yep.
Welcome back. And to call into session the Committee of Conference meeting on House Bill 1662. And would you, this is the mother of side-by-sides, and it explains the fact that we have 4 parts to this bill now. And I would like to go through each section bit by bit to see where we are on them. The first part establishes a data privacy and information technology security governance board within DHHS to oversee data privacy risk calculation and risk mitigation efforts, and provides for 2 employees with the department to accomplish these objectives. One of my joys as chairman of the Joint Legislative DHHS Oversight Committee is watching the development of this program under Representative Edwards. We had at least 3 of our monthly meetings in part devoted to this because we want to do 2 things at once if possible. Number 1, provide usable, helpful data. And number 2, make sure the security is the best it can be. And with those 2 necessities, how can it happen? So I'm going to ask Representative Edwards to say a few words about what he pulled off.
Thank you, Mr. Chair. This is really a great team effort with the department and with the Department of IT. Both departments have shown strong support for the idea of establishing a privacy functional capability within their departments. I think that there's a lot to 1662 that they could choose to do on their own without the legislation. But if we were to not pass 1662, the issue with that would be that the funding to create 2 new positions with entirely new skill sets would not happen. And what is the new skill set? You really need to have somebody who understands cybersecurity, understands privacy principles, and understands business process flows so that they can identify weaknesses and come up with mitigation strategies for them. And the department, when they've tried to do these privacy impact assessments, have had to rely on contractors. So they have even the capability today to do the entire bill, but the creating the in-house staff would start to develop institutional knowledge and memory and would just move the department along faster. So I think it's a good bill. I hope we can support it. If we can't, it's not the end of the world.
Unless I missed something in the big side-by-side, there is no difference between the Senate and the House.
Sure.
So it sounds like the Senate's position, the House's position on this is already known. So if there is no objection, do we sign off on part 1 of what we have before us? I don't see any. Any questions while Representative Edwards is on this topic? Okay, good. Thank you. The second section of this is found on the very bottom of page 5. It is housing expenses for homeless people and appropriation, $5 million. And you will see that this is carved up amongst the various towns in the next multiple of pages. And that's Senator Khan. I believe that is your project. If you could speak to that, please, sir.
Thank you, Mr. Chairman. So the first debate that occurred on homelessness funding for the biennium took place around House Bill 2. The Department of Health and Human Services, Housing Security proposed a dollar amount, and that was essentially halved during the appropriation process. So the amount of funding is significantly less in the biennium than what was originally requested, and that was the motivation of bringing this to the Senate. so it's essentially the same, it started as the same bill as what was requested by HHS for housing support for the biennium. We've passed fiscal 22, so let's focus on fiscal 23. ARPA rent subsidies are ending, and the availability and affordability of housing, those problems continue to persist. They're not going to go away anytime soon. It is a central part of the governor's task force on the Council on Housing Stability to try to provide greater assistance to towns and shelters for homelessness, and to help people avoid getting into that kind of situation. So originally, the Senate, on the bill that I proposed, tabled the bill. And the reason was that the route for distributing the dollars was suggested in the same way as it was for House Bill 2, an allocation that would go to the department, and the department would distribute it to the contracted shelters, the 40 contracted shelters that the department has existing agreements with. The disagreement in the Senate conversation was that's not providing a wide enough distribution across the state. That in fact, there are towns that are experiencing costs related to homelessness or housing insecurity that are being borne in every town. And that we needed to find a mechanism for that distribution. I've been working with Representative Umberger on trying to find a substitute for free and reduced lunch. And that substitute that we've talked about is Medicaid eligibility and enrollments. So the Department of Health and Human Services has a mechanism for reporting that by town to the legislative budget assistant. And that's where the April 3rd, 237 lives covered by Medicaid is the source for identifying which towns, how much eligibility they might have. We arrived at a $5 million, we were working with a $5 million request, and then distributed that $5 million based on Medicaid enrollments by town as of April 3rd. Those enrollments, there's not a town that doesn't have a couple dozen people who are Medicaid eligible and enrolled. So it does distribute dollars to all 234 of our towns. And it does so in a manner that the towns have local control. This is not just prescribed to the 40 towns that, 40 shelters under which have contracts. This is allocated to towns. Now, towns, I've started following Representative Edwards' thought pattern. Towns are help homeless and people in risk of homelessness in a variety of ways. It's either through rent subsidies, mortgage subsidy, because if a person is in risk of losing their home, that's a taxable property that's going to go into default, and the town is going to lose those dollars. So I've been on a city council. That's what we did. That's another way. Those are the direct routes. The indirect routes are the towns make payments to homeless shelters and to other community service housing agencies that provide housing assistance. That might include community action programs across the state or women's violence protection, just to give you a couple. And I happen to check with your towns to see what they are doing as far as making payments from their town budgets to either direct subsidy or indirect subsidy through payments through third parties. And each of them is doing all of the above. So in summary, I think we've got a solution to an issue that is going to persist into the fiscal 23 year. We have estimates from the department that this is 1,500 people who are homeless in the state during this last season. We have estimates from the Department of Education that say that there are 4,000 school-age children who experience homelessness in the course of the school year. And we only have 965 sheltered beds. So this problem is going to persist. And if it's not in your town today, amen. But this is a relief valve, and it enables your town to contribute to some bigger efforts in your counties, which no doubt are being paid for with local monies. So that's the position of the Senate when this came to a vote fairly recently as an amendment on 1662. It passed unanimously on a roll call vote, 24 to nothing. So we've achieved that bipartisan buy-in to this. I hope we can do that in this committee of conference. Thank you.
Any questions for the senator? Representative Edwards.
Thank you, Mr. Chair. Senator Khan, you and I had a chance to talk about this the other night, and since then I've been trying to continue to come up to speed on this. As I understand it, the state, for more than the past budget cycle, has had a fund where it could we could have the governor's budget put money into an account that would be authorized to be spent in the manner that your bill prescribes. And I just want to verify with you, if you think that that's true, that there has been, for more than one budget cycle, an account that the governor could have funded that would have met this purpose.
I think there are people here. Could we ask that of somebody from HHS?
It's up
Would
to
be more familiar with that.
It's up to the chair.
Somebody from HHS. That would be you. You are indeed somebody.
Thank you, Chris.
It is now.
Good afternoon, Chris Santinello, Department of Health and Human Services, Associate Commissioner. I think, if I'm understanding your question correctly, Representative Edwards, the department has, for the last two by budget requested dollars for shelters, specifically for shelter services. So that money would be added to our contract line to go to shelters. This is a little different, and that has not been funded for an increase in that. This is a little different because it would go to the communities. And I think one of the benefits of it going to the towns and cities is it really could be used to keep people housed, right? Because that's ultimately what we want to do, is have people remain in their where they are housed so they don't become homeless.
Follow up. Okay, so you just taught me something. You taught me the distinction between what we've had for a few years, which is money in a homeless shelter program, and that this is distinct in that this is money that can go straight to the towns, and we've not done that in the past.
Correct. And towns, depending on the community, could choose to give that money to a local shelter. They could use it to help keep people, in their place of residence. So our money today, we have at the department, goes out in contracts to support the shelters once people need a shelter.
Okay, so this takes me in two directions. One, if it's general funds, does it lapse on June 30th of 2023? In other words, if the governor uses general funds, are we creating a use it or lose it kind of situation for the towns? That's one part.
So I'm going to look at John, who left. I believe, don't leave me here, John, you got me. I believe that general funds do lapse unless it is indicated differently in the footnote. And there's nothing in the legislation that prevents that. Thanks, John. Teamwork.
Good job, Mr. Williams. Okay, so just so you know, I have a little concern there about, this is a new program for the towns. It's use it or lose it money. You know, it's just sort of setting them up to fail because they don't really know how to spend this kind of money
Well-
when the state has given it to them.
So we would distribute it by, there's a date here, I want to say August 1st. We would put, when we distribute it, what it would be used for. I do think we could look to add something about reporting so we would know how people are spending it. And also, I think what's key in this bill is really, we already are partnering with the local welfare administrators, and that's been really successful. And we would actually put that in any letter that we put out, because some of the smaller towns probably don't even know the work that we're doing that's in the larger communities. And we would really continue to do that to help those communities.
So one final. So give us some context here. This 5 million relative to what Division 3 gave for homelessness
Yep.
in the current biennium.
Killing me.
I'm putting you on the spot.
You are.
Yeah, I just want to know if this 5 million is effectively the same amount that we just matched it, or if this is a tiny fraction of what we put into the homeless money.
It's a significant portion to assisting people who may be experiencing homelessness. I do not have our final budget because it's a combination of general funds, and there's a lot of federal funds that we put in our budget. I don't know if Senator Khan knows. Oh, good, he knows.
Oh, you know the answer to that?
I do.
Oh,
Perfect.
The budgeted amount per fiscal year is around $3 million.
Just for the shelter services, though.
Yeah.
We have other programs. That's my same.
Other questions regarding this part of the bill?
And, Mr. Chairman, if I might,
Senator?
I've had several follow-up conversations with the department. They have made a few suggestions. I'm glad to hand those out to you at this point. And I read these suggestions as expanding the uses of the funds by the local government entities. So it's not not putting any further constraints on it, but it's opening it up, as Chris Santinello is just describing, to make sure that those people who are at risk of homelessness, that the towns are able to address that need very clearly in addition to the homelessness situation. So I'll pass this around.
Yes, please.
Thank you.
I have this concern I think I share with a number that I really don't like bills being attached to other bills being attached to other bills, and especially if there's a lot of money involved, that we do have a budget process. We had one a year ago, and we've got one starting pretty soon. And this looks like a wonderful item for that budget, but here we are in the middle, and now we've got the request for a very large expenditure of money. And I know that because numbers of these bills with requests for a large amount of money are coming, I'm not quite sure what this is going to do with either the money we want to keep aside or the money perhaps we want to give back to the taxpayers. That is a concern. The issue is separate in my mind from the general concern, but this issue falls into it in that manner. It's a procedural kind of problem that I have.
If I might address that, Mr. Chairman. Yes.
Please, sir.
And I understand your broader concern. The original request by the department was for $8 million, $8 to $9 million, closer to $9 million in each of the 2 years of the biennium. So I think what this is doing is for fiscal 23, essentially coming up to that original request, which we were unable to fund originally in the HB2, but we do face this wonderful situation at the end of fiscal 22, looking into fiscal 23, where we've got some resources. And I think the conversation that we've had in the Senate is this is a great opportunity to see a rising tide lift all boats. Not everybody's fortunate enough to be lifted by some of the ideas that we've come up with that hopefully will be enacted upon, tax relief and things like that. This is a means of helping those that we otherwise would not be. And I think it does fall into that category of what were we 18 months ago, or whenever we started that budget process, what were we unable to do that today we are, and that we can in fiscal 23 and achieve some of the goals that departments and the state have.
Am I correct in assuming, and I think I heard it, but I want to nail the point down, it is much easier and I think cost effective to help a person who's in danger of becoming homeless than it is to gather up the homeless and get them back into something?
I think it's partly dependent on the services that are provided around that person. A person who's in their home doesn't have to face that terrible situation of, I don't know where I'm sleeping. But for those who are in the shelters, the kind of supports that they can provide if they're adequately funded, like job training, like job location. Those are terrific services that hopefully lift people out. I remember Andy Sanborn's line, we're giving people a hand up, not a handout.
Yeah. Senator Carson,
Thank you, Mr. Chairman. May I ask a question of Senator Khan?
please do.
Thank you. Senator, in reading this amendment, Senator, I see where the point is or at risk of homelessness, and I think this speaks to the question that has been posed about helping people before they get homeless. So the allocations of this fund could be used to address that situation, to get to people before they find themselves without a place to live. Am I correct?
I agree with you. Yes.
Thank you.
Senator Birdsall.
Thank you, Mr. Chair. With that question, dovetailing on Senator Carson, have you heard of the organization called Family Promises? Would that be you might be able to answer, would that be an organization that would benefit from this?
Potentially. So the control of these funds are with the cities and towns. So it would be up to the cities and towns. And so they would have that option, but so it could.
So
Does that help?
follow
Yep.
up. So when we have one hopefully being built in Derry, we'll know a little bit later in the summer. So it would be Derry that would provide them any funds that they could.
Correct.
Thank you.
Or they could use it in other ways that meet the needs here.
Senator Khan.
Yeah, thank you, Mr. Chairman. Senator, thanks for that question. I checked in on Hampstead to see what kinds of indirect as well as direct assistance the town was providing. Currently, they are providing indirect assistance to homeless people through Isaiah 58,
Right.
through a community services organization, and through the Rockingham County Services. And yeah, so they demonstrated around a $30,000 expense out of the town's budget to support homelessness, but not in a direct subsidy.
All politics is local. Representative Edwards.
So I buy into the theory that helping somebody at risk before they become homeless is preferable than waiting until they are homeless and have a much bigger problem. I buy into that entirely. So but it does make me curious about where the rubber meets the road. When we start to tell these towns that they can help people at risk who are not homeless to help pay their mortgages, in order to make sure that that's done in a fair way, that's not biased towards their best friend of 20 years, do we have guidance written today that would explain how to apply some fair process to determining who is at risk and how at risk they would be? Because if you're at risk, you could be like crucially, seriously, like tomorrow at risk, or you could be 3 months, I may have a problem. So it just feels very hard to write guidance around that. What have you been able to do?
So there's a couple of things, because I think each city and town has their own guidelines for how they provide welfare assistance, and they have a welfare officer. And so that would come into play. At the same time, we're doing a lot of work with certain welfare directors in certain communities and providing support and guidance. Like we had one community that reached out to the department to say, you know, we're seeing an increased number of people needing assistance. And so we actually partnered the department, and a welfare director from a larger city met with that town and really helped give them some guidance and some ideas on how to follow it. So we would still have to follow whatever rules your city or town may have. But I think by really working with the welfare directors around helping people stay in their homes, I think that is a little different in some communities than others. Did I answer your question?
Follow up, Representative Edwards.
So it sounds to me like what you just said is that this is new state money that's going to the towns, and that to the extent that they happen to have rules similar about helping at-risk people, they could certainly use their own guidelines. But at the state level, we have not yet developed any guidelines on how to define at-risk and what kind of proportionality that may justify in using state funds.
So we would be developing guidelines for communities to follow. But unless there's something added in here, we don't have a lot of authority to say, oh, you used it inappropriately. But we could put very strict guidelines as to how you use it, but yet we want to be careful that there's flexibility. That's the piece in Senator Khan.
Representative Turcott.
Thank you, Mr. Chairman. I want to go a little bit further than Representative Edwards, what he said about at risk. I would agree that it's a very vague term, and for me, would be open to a lot of interpretation, and that may be good or bad. The chairman of the committee mentioned the budget process. I do believe also that's the place for this. The last part, in reading at least this amendment that was distributed, when it talks about rehousing, shelter, and then it talks about landlords. Having been one myself in a distant past, I know there already exists multiple layers of programs to help those who are in looking at eviction or whatever. And I can say the majority of tenants that we had in the past were excellent tenants, but I can also say that there might have been some that I might not want the town necessarily helping and remain in one of our units. So I think as a whole, I would prefer to see this in the budget process myself. Yeah, I have problems with the terms at risk, and I think there's some potential landlord issues there also. Thank you, Mr. Chairman.
Thank you, Representative. The chair calls on Representative Hunt.
I just did want to say we could use the HUD guidelines that outline for people experiencing homelessness. So we would put that in any guidance.
Thank you, Representative Hunt.
Yeah, so not that this is my issue at all, but I have been on committees of conference before, and actually got into trouble once when we had an amendment that came in, and the amendment was not in either the House or Senate version. That it was a new language completely, and I assume is at risk is a new conversation item, and that I was my amendment. We was found by the speaker at the time that it was not permissible because it was not in either the House or Senate version. It's a new material. So whenever you introduce new material, it jeopardizes the committee of conference. So my understanding is we cannot take up this amendment at all because it's a new subject or new interpretation with this at-risk concept.
Senator Khan.
Thank you, Mr. Chairman. So if we want to go back to the words that are in here, it's homeless people seeking shelter. And I'm fine with doing so. I think what the department is looking to do, and I think what assists the local government, is to recognize that there is a opportunity to help people avoid the homeless situation. I mean, we're talking about safety net issues here, right? People fall into homelessness. I mean, they've fallen through a safety net, and we need to rebuild it. The safety net, if it can be in place to help people from falling, then that's terrific. There's some legitimacy to the question raised about a local community. How will they exercise that decision about at risk? But I think that what the department is doing here with this last line, that they're going to use their relationship with Local Welfare Administrators Association, a body which actually does exist and is entirely populated by community welfare officers, that they will develop these best practices for use. And I guess I come back to one, we did consider this in the budget process. We assumed, we legislated that there were not the dollars until we came to this point. And there are many items that we're going to face as we come out of this legislative session, adding dollars to, that we were unable to do in our original budget allocation for this biennium. This is not an isolated instance, number one. Number two, we're trying something different here. If by allocating only to shelters to answer the issue of homelessness or at risk of homeless doesn't reach enough people in our state, doesn't reach enough communities, is not providing local relief to local governments in a sufficient way, then this is the way to do it. Distributing dollars on a fair basis across every community allows every community that determination as to how to best use these dollars. So I'm coming back around to the main point here, and I hope that we can get to the place of supporting this amendment. Thank you.
A few questions from me. Number one, is there anything to prevent the towns generating the dollar amounts that are listed if they saw that there was a homeless problem in their town and they wanted to deal with their town people?
I don't think there is anything preventing. I think what we are anticipating, what we can see in front of us right now, there is a bubble. And can we provide enough housing where that can be relieved? And right now, we are facing housing people in hotels and in shelters that need additional space and some renovation. These are the way, this is a mechanism to get the dollars to the towns for them to either directly provide the assistance or to participate along with other towns to get that assistance provided.
Which begs my question about whether if the money is not given to the towns cannot put it in their budget or out of their reserve or rainy day fund. And I believe my answer would be, of course they can. My second question is, I don't remember, was there a hearing on this bill in the House? Did it go to a policy committee?
I know that it went to the Finance Committee, and I guess I'm gonna need some help there. Because Representative Pearson likely has a recall of this.
Not really.
Well, the underlying bill started off as a Senate bill, eventually was tabled and then reinserted into the bill in front of you, HB 1662 at the most recent Senate session. So to my knowledge, at least the underlying bill that was filed as prime sponsor by Senator Khan did not have a hearing here in the House
Okay,
on
thank
your bill.
you.
But if there's another bill, I don't have knowledge of that.
I think the way that I was anticipating some response is that in 2002, when the department proposed additional funding for homelessness, how was that filed?
In 2020.
Okay,
Instead of 2000, yeah, as part of our budget request.
yes.
Okay, that's how it was filed.
Senator Carson?
Thank you, Mr. Chair. I have a couple of questions. And I want to understand what the dialogue here is going on. Because you had asked about local resources to address the issue of homelessness versus getting a grant from the state for homelessness. Are you suggesting that municipalities raise local property taxes in order to get the money to fund a homeless problem they have in their community versus getting a state grant?
No,
Okay, could you clarify that, please?
because very often certain line items go down and certain line items go up, depending on a whole variety of things. And to say the money that would have come from the state needs to be generated locally does not require in itself property taxes to go up because some other things may go down. I'm just simply saying, can the towns not assume more of the local welfare needs? That's all I'm asking.
Okay, thank you.
Welcome.
My
Because
second
I live in Hampstead and pay property taxes, which are way too high.
I think we all do. So, thank you for your answer. The second question that I have, and it's suggestion concerning about the procedure. In the Senate, this bill was brought forward during a Senate session. We had a great debate and a discussion about this particular issue, and it was voted on by the full Senate. I believe it passed 24-0. But I think if the House has questions about the procedure, what I'd like to suggest, Mr. Chair, is that we take a break and that you consult with the House Clerk to make sure that you are following your procedures.
I'm asking my researcher if she would find out if this bill did come over to us. Representative
But
Hunt.
reinforcing what you're just saying is that they'll rule this is a non-germane amendment. Germane is in the sense to the committee of conference because neither House or Senate version had this language. So I'm arguing that we could never take up this amendment because it wasn't even in your version. I'm saying if it was in your version, if you had amended this when you amended this, this bill and added this whole section in the bill, if you had added this at that time, it would be germane because you guys have rules that allow you to do anything. But this is all new language here, right? It's been in particular. I'm just picking. I was sitting here and this at risk is a whole new concept.
Mr.
So
Chairman?
that is, I'm arguing that our clerk would rule that this cannot be permitted in the committee of conference report.
When my researcher comes back with the answer to the first question, I'll ask her to go ask that question.
Correct.
Senator.
I would refer,
Yes, that'd be great. The clerk.
We're going to
In
invite
lieu
the-
in lieu of that amendment, and we can just put that to the
And I
side
will ask the, oh, I'm sorry.
for a moment. We do have the wording that is on page 4 of the Senate approved bill.
But otherwise, you would withdraw this and just stick to what we're at.
Yes.
If it's not timely to introduce it, I just thought that it maybe added some clarification to, at least that the department wanted to have aired.
While we're waiting for the clerk to come over,
move on.
Representative Turcott, did you wish to jump in at this point on this point?
Yes, Mr. Chairman. So it's my understanding, I want to make sure I get this right. Although this amendment to 1662, starting on page
Bottom of 5 on the,
bottom of 5, and
Follow-
continuing on with all the dollar distribution levels, this passed the House but never was voted on, passed the Senate but was never voted on by the House. Is that correct?
Never heard.
I don't recall this.
Thank you.
And the clerk of the House will be over very shortly to say more. Representative Edwards.
And since we have some dead air here while we're waiting, as I'm listening to this, I'm thinking, what a fascinating policy discussion this is, and that if only we had a committee in the House that was good at reviewing this sort of policy, maybe they could have looked at it and provided a recommendation to the Finance Committee to whether we could consider funding it or not. And then I would also want to just add that we are months, weeks away from starting another budget phase, and that maybe this could be brought into the right process.
You do know the speaker said he would inflict bodily harm on me if I approved yet the establishment of another commission or committee.
I'm not asking for that.
Oh, good.
I'm asking for, we've got a budget process.
Okay. Well, that was the second half of, yeah. You were talking about a committee.
Sarcastic. We do have an HHS committee, as you may be.
I'm aware.
So
I think you'll probably come in about 2 seconds into doing that. Representative Edwards.
So if I
again.
may, I just, I worked with Senator Khan for a long time. I have tremendous respect for him. This sounds like a really great program. I like saving people at risk before they go over the cliff. But I just think this is a major policy issue for which the House has never visited it, and that it would be appropriate for the HHS committee to set this kind of policy, and not have it done in a committee of conference. All right, so that's, I'm a leaning no.
All right, Clerk of the House, would you come forward, please, because we are asking for a few rulings on things.
Mr. Chairman?
Yes.
I'm wondering if we could hold for a few minutes because I have called the Senate clerk and she is on her way over as well.
Well, the Senate clerk can come too, and I don't think they'll be speaking at once, but we
No,
could have
and
that.
I'd like to bring up the point that it's my understanding in a committee of conference this morning, an amendment was adopted and approved by both sides. So I think we just need to get some clarification on this particular issue. It's my understanding that this has been done many, many, many times in the past, but since the issue has been brought up, I think we need a ruling from both sides. Thank you.
I agree with you. And I see we have two very different but parallel issues here. One, should we do this? And secondly, may we do this? And they're separate issues. If we may do this, we don't necessarily want to do this. We could. But if it is ruled out of order by, certainly since I represent the House's side, I'm interested in hearing what the Clerk of the House has to say. And if it's not kosher to him, then it won't be kosher to me, even though your clerk may make it kosher for you. And then once that dust is settled, it's, do we want to do this or say, no, wait to the next budget?
Mm-hmm. I totally get it.
The clerk of the House rules that we may do this. So the question then becomes, do we wish to? And I think we've discussed that very thoroughly. And I would ask the Senate, do you wish to, I think it would be obvious, do you wish to defend the Senate's position in this? Okay. I would presume you would, but I would want to hear it. Senator Carson, we're moving on to vote on the issue of this second part of the bill, and the question is, do you, with your Senate colleagues, wish to defend the Senate's position on this?
Yes.
All right, now the
Yes, of
House.
course we will.
Yeah, the House. Representative Turcott, yea or nay?
Nay.
Representative Hunt?
Clearly this needs to go to a committee before we can vote on, so I would say nay.
Okay, but that kills it then.
Great potential policy, worthy of HHS.
And I would say the same kind of thing. Much needed, wrong way to do it. So the House position is no. So therefore, Section 2 has been voted out.
Mr. Chairman, I'm going to request that the Senate take a break so we can discuss the rest of the bill. So,
Okay. How long do you need?
maybe a half an hour?
Okay.
So I've been invited to that Israeli General Consulate meeting.
Okay.
So it starts at 2.
At 2.
Yeah, we're on red.
Is it
It's time. You wanted to caucus on items 3 and 4 relevant to what we just did to items 1 and 2.
we just wanted to caucus, Mr. Chairman, we just wanted to discuss the bill in total, so.
I appreciate that.
Yep.
Yeah, we were having a intellectual stimulating conversation too.
Oh, we were talking about the Red Sox. And the season, the upcoming season.
I can name you the 1961 starting lineup.
That would be interesting.
We'll do that. Yes.
I used to know the starting lineup of the 1967 Baltimore Orioles.
Oh,
Well,
wow.
We talked about the hockey, Bruins losing,
But the Celtics winning.
but the Celtics won. There's one bright spot. So now it's depending on the Red Sox to have a great season and bring us a championship.
I'm holding my breath.
We are too. It'll be a great, hopefully the weather will be great. A lot of good times down in Boston at the Red Sox Stadium. And
Should we all stand and sing One Verse of Sweet Caroline?
No.
you don't want to hear me sing, Mr. Chairman.
Okay. Item number 3, amends the provisions relating to payment of an employee's wage by direct deposit. And this is a Senate, I don't want to use a bad term. I'm going to say add-on, but I don't mean that pejoratively, attached to this bill. So could we hear from the Senate about why we should consider it positively?
Thank you, Mr. Chairman. And I appreciate your letting me speak about this bill. This bill, I think, is something that we really need to do. We are far, far, far behind the times when it comes to electronic payment of wages. And so this bill really permits employers to pay those wages electronically. We already allow people to have, especially if you get any kind of federal subsidy, money goes from one to the other right into a direct deposit that the recipient designates. And so this, Mr. Chairman, just goes along those lines. There's a couple of points I'd like to make. Most states in the United States already allow this to go on. And if any of you have seen the Chime commercials out there, where they advertise, a company that you can get the money a day or two prior to actually receiving a paper check. It's automatically put into your account and it's available for people to use. Again, 29 states permit electronic page payments. There's no complaints. Employees tend to quickly adapt and are often very thankful for the ability to have this. They would like to be able to choose between direct deposit or payroll cards at any time. And employers prefer this because now they're really not dependent upon anyone receiving a paper check. It's not saying that an employee cannot request a paper check. They can, but most employees would prefer to receive some sort of an electronic card. Again, the point, most payments are already electronic. Virtually all government payments are paid electronically. Tax refunds, unemployment, Social Security, nutrition assistance, disability, etc. 93% of American workers are already paid via direct deposit. Just a little factoid, European workers have not seen a paper paycheck in decades. Government employees are generally all paid electronically, and it's only really the private sector employees remain mired in wage payment laws better suited to the 1940s. So, in talking about payroll cards, they can use them any place that they would use a check. There's free online bill payment and internet shopping. There's no charges for those. Travel oftentimes requires electronic payment for flights, hotels, rental cars, etc. There are protections from fraud and unauthorized use and a dispute resolution process in place. They can't be overdrafted, so there's no fees. And They often include free savings account and additional cards for family members. This bill passed the Senate, and it went over to the House, and the House heard it, and they made the motion of interim study. So the Senate feels very strongly about this bill. It's time that we join the modern age, and hopefully we can talk about this and see if we can get this passed. Thank you, Mr. Chair.
Yes, a question to the senator. Most of my employees already have direct deposit of their paycheck into their bank account. So what I'm hearing that we need this for some very special reason, and my people already get this. What
Thank
am I
you.
missing?
Thank you for the question, Mr. Chair. It really gives the employee choice about how they want to receive their paycheck. Some people don't want to deal with a bank. They don't want to deal with paying fees, everything else to a bank. Some people just don't want to have credit cards either. So they would like to get something like this where the money is automatically taken out. Everything is online where they can go at any point and look to see what their balances are. It's just an alternative way to pay people.
My employees have this now.
They would have direct deposit, but they would have the option of having a pay card.
What is a pay card? I know what a check is. I know what direct deposit is. What is a pay card?
A pay card is just like a card that you would get for like your debit card. And your paycheck is loaded onto that card.
Oh, I see.
Instead of sending it to the bank,
Uh-huh.
it's loaded onto the card.
Like a Dunkin' Donuts card, where you buy it, and then every time you go, I'm only hearing about this, I don't do this, but you go through the drive-through and you hand them the card, and it debits down what your triple mocha latte appuccino thing that you just bought. And now your card shrinks in value. Is it like
Correct.
that?
Yes.
Okay, so it's like a Dunkin' card.
That's
Okay.
right. But
Wow.
well, you could buy a lot of Dunkin' Donuts with your paycheck. But
No, I get.
if that's
No.
your thing, if you like,
Yeah.
Dunkin'
Okay.
Donuts, it's the money is always readily accessible to.
You're saying the third option this brings in
Yes.
is a pay card like
Yes.
that. Okay, thank you. I got it now.
Okay.
Senator Birdsell.
I would think of it, and every week it's your paycheck is loaded back on, much like an EBT card works.
Uh-huh.
The government every week puts your money loads it up on your EBT card, and then you use your EBT card. It's much like that.
Uh-huh. I'm a dinosaur. Representative Turcott.
Thank you, Mr. Chairman. This bill did come over from the Senate to our Labor Committee, on which I sit. We, over a couple weeks and several public hearings, we looked at this particular wording. We looked at multiple amendments from individuals on our committee. At the very end, I put in an amendment that brought it back to the Senate's original version. That final amendment attempt, I should say, failed. That was followed by the motion for interim study. I can tell you that this issue has been in our committee now on and off for a very long time. I can tell you that section of employment law is what I would consider excessive. Right now, it sits at 695 words on just how an employer will pay their employee, not when or on how many frequent occasions. That used to be every week, unless you got special dispensation from the commission. I actually put in an amendment on that to change it to every 2 weeks because so many of our employee businesses wanted a different time. So that changed. What I'm going to suggest here is that, like so many things we do, we take what some would consider horrible language and continue to make it worse and more burdensome on our businesses. In the Labor Committee, our goal is to reduce regulations, reduce burdens, and make everything simplify everything for our businesses. I'm going to give you a couple examples of why this is actually worse than what we already have. But at the end of our last hearing, almost half jokingly, I said, you know what? What we need in this section, instead of 695 words, we need a sentence that says this. Upon initial employment, the employer shall inform the employee the method of payment for wages earned by the employee. What a concept. Simplify, eliminate 3 or 4 paragraphs. Now, granted, there need to be a few other little minor changes in there, but this is just too excessive. It makes it more difficult to understand. And like I say, we went through this on our committee for 2 weeks, going back and forth. We spent an inordinate amount of time on this, and in the end, we sent it to interim study because we believe that's where it should go. I mean, a couple of the issues that some of us saw, especially on the very first page, page 14 there in the middle, it talks about an employer shall be liable for late payment of wages. Really? And this was my favorite. Should an employee's payroll card be lost, stolen, or damaged, let's stick with loss, and the funds are no longer accessible to the employee, the employer shall be required to provide the employee with a replacement card within 24 hours. All right, so on Friday night, I'm out at my favorite pub, and then I happen to lose my payroll card. I call up Saturday morning to my business who's closed and say, hey, I need a replacement card in 24 hours. So what I'm going to suggest is we, again, Labor Committee, after much work, said interim study. I'm going to suggest we stick with that. And what I will offer to the Senate is this fall, if I am reminded of it, I will put in a bill that actually does attempt to bring 695 words down to maybe 50, because that's where we should be going. We should be making it easier for our businesses, not increasing the burden on our businesses. Thank you, Mr. Chairman.
Anything?
I don't know. So I think I remember the C about the local bank that made it came across our committee, but evidently this debate of paychecks has been an ongoing struggle for years and years and years, and I'm not sure what the right answer is, and it always seems much more complicated. But the idea of an employer having to replace a card in a 24-hour period. So if the card was lost on a Saturday, how's the employer supposed to get that card to them? And I don't know. That seems problematic to me.
2 sentences above that seem worse. Should an employee be unable to access their wages due to a technical or processing defect, the employer shall immediately provide the wages to the employee with a replacement payroll card, etc.
Right. Yeah. How do you make that happen?
I mean, it should be quickly, but immediately? Yes.
Just one more point I forgot to mention, and this isn't the first place I've seen this. There's another bill or committee or conference coming up tomorrow, I believe, where it's a similar situation, and we see it a lot in labor. We attempt to fix a problem that only affects a minute portion of our population. We put in 695 words, and I'm just using this as an example, to fix the 1 or 0.5% of individuals who, for some reason or another. So, when we do that, you create all these burdens and expenses on businesses for that one individual. Like I say, I really truly believe, for everybody's benefit, that the business should have the ability, when they hire an employee, to say, this is how I'm going to pay you. We could even eliminate another 400 words and say, and this is going to be your pay period.
Would you say then that, let's say I'm looking for work, even though I have 3 full-time jobs now, but let's say I wanted another one, and I went over to ABC Widgets, which you own, and you said, "Welcome, so glad you're considering coming to work here. This is how we pay you. You get a payroll check every other week." And I say, "I don't want that." And you say, "There's a lot of other people that are hiring out there." And I go find working for XYZ Widgets that's willing to do something differently. The employer has the right to broaden it or narrow it depending on the employer's choices. And I have the right to accept or reject accordingly. Is that what you're saying?
In a shorter version of that, yes, Mr. Chairman, but that's exactly the point. And again, this is something we emphasize on the Labor Committee all the time. The decision on things that go on within a business should be between the employer and the employee, or the business and the employee. It shouldn't be politicians or bureaucrats saying you have to do this, you have to do this, you have to do this. Simplify it, help our businesses operate. So in your scenario, that's exactly what I'm suggesting.
Thank you. Well, since I see nothing further, let's do a vote by orders to see whether we keep this or not. Senate?
Mr. Chairman, we're not voting individually on each particular section. We will take one vote on the bill at the end of every discussion, at the end of the discussion. That is how we do it. So
That is how, who does it?
that is how we do this.
That's how the Senate wishes to do this?
Yes, we will take one vote on the bill as a whole after all the
Okay, that's
discussions
not
have
how
happened.
I've been rolling thus far, but since you've given an ultimatum, I have no choice. Representative Hunt?
I think we should take this on the bill.
Okay, and Representative Turcotte?
I think we should take this out of the
We
bill.
are voting our way, and that is on each item, and you're saying yes or no to this?
I'm saying this should be out. I think I've made very good arguments as to a much better option and
Okay,
the
thank
amount.
you.
Yep, sorry.
That is what the House has done. Senate will respond accordingly. Item number 4 requires third-party sellers to provide certain information to online marketplaces and to consumers, and deems the failure to do so a violation of the Consumer Protection Act. We had a spirited decision while the Senate was caucusing about this, and I'm quite in favor of it. But we could cut to the chase because we've all heard the arguments, and I would like to poll my delegation to see what you're going to say. And this is on item number 4, Representative Edwards, third-party sellers information. And I think we've discussed it to death. Representative Hunt, how would you vote?
I would like this removed from the bill.
And Representative Turcotte?
Removed, please. Thank you.
Okay, well, that's it then, because we have more than one. So now we are done, and now we can vote on the entire bill. When we looked at it individually, we said yes to Representative Edwards' hard work on secured data in DHHS. We all said yes on that. Items 2, 3, and 4 were said to be out, with the Senate voting for and the House voting no. So now, Senate, up or down on the whole bill?
Mr. Chairman, the Senate is requesting a recess to a later date so that we can caucus and look at everything. Thank you.
And the recess date has been scheduled for 10 o'clock tomorrow morning.
Check our schedules.
I can't make that.
I would like to have that in hand because I'm having a procedure done on Wednesday. And if you could look at your schedules now and let me know, is there a time tomorrow other than 4 p.m.?
We already have something at 4 p.m.
What's that?
I said we already have something at 4 p.m.
That's why we can't do this at 4 p.m.
3:30?
And I have committee conferences. I possibly could do 3 o'clock tomorrow afternoon.
3 o'clock would be okay.
3 o'clock?
Yeah, that depends on how long some of these other things. And if we can't, Mr. Chair, and if everyone can't be here, we can always reschedule it after that.
We have until mid-afternoon on Thursday.
Yes,
Mhm.
exactly.
So I will be alerting the clerk of the House for 3 o'clock tomorrow afternoon to come out of recess. Thank you.
The Israeli ambassador says hi, by the way.
Oh, thanks.
The Israeli ambassador. He's the general counsel, former ambassador. He was in the state. I went to the state, the West Hall, and he's there in there now. So it sounds like you got Spirit of the Day. Baby
Yeah.
going.
Well, I mean,